That would be great.
Legislators Abbott Keenan,
Here.
Chase,
Here.
Cody,
Here.
Bush,
Here.
and Kinney.
Great, we're all here. Welcome, everybody. We're going to call to order, obviously, the meeting of the Health and Human Services Committee today, March 23rd. And I just need a motion to waive the reading of the minutes from our previous meeting, please.
So moved.
Thanks,
I'll
Legislator.
second.
Dr. Chase, all in favor?
Aye.
Aye.
Okay, Melanie, we don't need a roll call for that, or do we?
Right, now we just need another one to approve the minutes.
Yep, so now we need another motion and a second to approve those minutes, please.
I'll move it.
Dr. Chase?
I'll second.
Thank you, Legislator Cody. All in favor?
Aye.
Aye. Okay, so we obviously have many moving parts with Human Services, and we wanted to invite our Adult and Long-Term Care Services Commissioner, Lisa Alford, and also Joanne Decker here today, who is the Executive Director of Adult and Long-Term Care, to talk about our seniors, all things COVID, where we're at. I know there was a hotline that we put up to try and help seniors that don't have access to the computer or who are struggling in terms of getting their vaccines, in addition to isolation and if there are any food deliveries still going on. So thank you so much for joining us.
Can I just jump in here for a minute, please?
Sure.
Excuse me, Lisa. I had a very important phone call I had to take, but I'm done. So I just want you to know I'm here.
Okay.
All right?
Awesome.
Thank you. Sorry.
No problem. Okay. So Lisa and Joanne, would you just bring us up to date on the things that you feel are important for us to know?
Yes. Good morning, Chairman Abbott Keenan and members of the Health Committee and guests. As Commissioner of the Department of Adult and Long-Term Care Services, I'm pleased to offer you an update on our past year's work, which has been quite comprehensive, especially as it relates to seniors. And as you mentioned, Joanne Spoto-Decker, our Deputy Commissioner and Executive Director for our Office for Aging, is joining me here today. We'll begin with a general overview of how our Office for Aging responded to the COVID-19 pandemic. And Joanne is going to go over a few highlights as well as some statistics for you.
Great.
Joanne, you need to unmute yourself.
Melanie.
I hope everybody hear what I have to say. So let me start again by saying good afternoon and thank you so very much for having us. It certainly has been a very, very busy year for the Office for Aging. Our senior nutrition program managed the COVID-19 pandemic senior nutrition and healthcare worker hotline follow-up, responding more to over 3,000 calls. The senior nutrition hotline callers were screened for nutritional needs, including nutritional counseling and case management, and then referred to other programs and services provided through the Office for Aging, New York Connects, and other department units as appropriate to meet additional needs related to the COVID-19 shelter-in-place guidelines. Over 350,000 plus takeout and home delivered meals, 350,000 plus takeout and home delivered meals were provided to seniors and healthcare workers. Our nutrition unit led this coordinated effort with multiple community programs and providers, as well as our county interdepartmental staff. Office for Aging and New York Connects facilitated the delivery of masks and pallets of hand sanitizers from the New York State Office for Aging, resulting in the distribution of more than 35,000 masks, 35,000, and cases and cases and cases of hand sanitizer to assisted living facilities, nutrition providers, senior housing, senior centers, community-based agencies, transportation programs, totaling more than 30 or 65 programs and organizations. Each year, the Office for Aging plans for programs and services that we will meet the needs of Onondaga County seniors and their caregivers for the coming year. We hold in-person public hearings to receive valuable feedback on what is working well and what may need to be reimagined or recreated in order to meet the diversity of need. Stop. This past year, during the COVID-19 pandemic, we were unable to hold these important in-person forums. As a result, in November 2020, we called Onondaga County seniors and service providers to offer their input on issues, programs, and services that were important to them, their caregivers, and their families. 238 seniors participated in our senior survey. We asked them, what concerns you the most? Seniors were encouraged to select all that applied. Not surprising, 62% of the respondents said the pandemic. 61% said health and fitness. 32% responded that healthcare costs were their main concern. 31% said home repairs. 30% of the respondents were concerned about living alone and being isolated. And 29% said they were concerned about depression and anxiety. 28% of our respondents said living independently concerned them. And 20% were concerned of how and where they were going to get their groceries. There were other concerns as well. Seniors were asked, what Office for Aging services have you used? An amazing 69% responded that they have used our nutrition services. We had dozens and dozens of senior dining sites throughout Onondaga County, but during the pandemic, we had no choice but to close the sites. However, we immediately pivoted, and as the summer progressed, we were able to arrange for pickup meals at senior housing and senior centers. We were able to distribute the farmers market coupons during the pandemic using COVID-19 safety protocols. And lastly, home delivered meals continued and continues to be provided to those who are incapacitated and unable to shop, cook, or prepare their own daily meals. The need for this service has definitely increased over the past year. And as everybody knows, and especially it's more important now, meal delivery is a critical safety check for those seniors who are isolated. Our nutrition unit also manages our health promotion evidence-based program in keeping with our goal of a healthy aging process. Courses offered and still are using a Zoom platform, and they are chronic disease self-management, Tai Chi for arthritis, and diabetes self-management program. 59% of our seniors have used one or more of our community service programs. Our community service programs for seniors include many diverse resources for older adults, including referrals for home repairs. And you just heard me talk about 31% of our seniors that responded to the survey said they were concerned about home repairs during the pandemic. We also have housing counseling, legal services, shopping services. Again, a program that we were able to help with for the seniors who were unable to go shopping during the pandemic. We have social work activities and certainly transportation programs, 15 of them throughout Onondaga County that we are able to make referrals to. Our neighborhood advisor program, now in its at least, I think 38 or 39th years of operation here in Onondaga County. Our neighborhood advisor program provides services to older adults to assist them in maintaining their independence. They also help people apply for income stretching programs. Most of these programs were still operational during the pandemic, but we had to adjust them for COVID-19 guidelines. I must say there was a huge increase for shopper service at this time. This number has continued to stay high as many seniors are homebound and have no one else who are able to shop for them and can't get out of their home to shop for themselves. Our HEAP program, the Health Insurance Counseling Assistance Program, provides free and unbiased health information and assistance. And I want to stop here and just thank the Health Committee, members of the Health Committee, because many of you have contacted our office regarding health insurance counseling and a lot of the programs and services that we provide. So we're very, very honored and privileged to have your faith in us. So I want to continue with the Medicare program. For those of you who have called, thank you. We've had a very successful open enrollment this year. It was from October 15th until December 17th. Our volunteer counselors assisted in explaining medical bills, providing information on Medicare, supplemental health insurance, and prescription drug coverage. Certainly calls have increased during this pandemic because of isolation factor, and also the fact that there are so many ads on television telling people to contact, change your insurance. So the calls potentially exponentially increased. 50% of our seniors said they have contacted us for information and assistance. Our number, 315-435-2362, is staffed from 8:30 to 4:30. Our staff will inform you on what is available and explain the eligibility requirements, and they will also give you information and contact numbers for other community resources when available. 26% responded that they have reached out for the Office of Aging HEAP program, the Home Energy Assistance Program. HEAP helps individuals with expenses for the one-time payment to their utility company or fuel vendor. Our office helps county residents age 60 plus access the HEAP benefit. During that time, we also assist seniors with linkages to other income stretching programs such as SNAP and the Medicare Savings Program. During the pandemic, we continued to go to senior homes to pick up necessary paperwork to avert their energy emergency. There has been an increase, kind of an uptick in new participants in the looking for HEAP this past year. 18% of our surveyed seniors have received assistance from our Caregiver Services unit. We offer information and consultation to family caregivers. In our caregiver discussion groups, caregivers share their experiences and find peer support. The Institute for Caregivers offers public information by local experts on a wide variety of topics used by family caregivers. Currently, these presentations are offered on a live Zoom platform and are available for future viewing on our website. What the pandemic's taught us about our caregiver program is that not only will we hope to have in-person classes as fall begins and there's more vaccine, but also we are going to continue our virtual classes as well. So people can look at those classes any time of day or night. 8% of seniors who responded to the survey have used our expanded in-home services for the elderly program, or as we call it, ISIP. ISIP helps older adults and their families delay or avoid placement in nursing facilities by combining case management services and non-medical supportive services for frail seniors who are age 60 years and older. Many of those people already receiving ISIP services during the pandemic were concerned and afraid to let their home aides come into the home to help them. The wide range of services and providers for long-term care can be very overwhelming. New York Canucks offers free and partial information and assistance to help Onondaga County residents and their families in determining what services or programs are available to them and which ones meet their needs most appropriately. New York Connects is a little bit different from the Office for Aging in that New York Connects provides information and assistance on long-term care services and supports for people of any age and irregardless of payer source. We asked surveyed seniors, have you experienced feeling down, depressed, or anxious in the past 6 months? 59% of those responding said they felt that way for several days. 23% said not at all. 18% said every day, and 10% more than half of the days. It is important to note that this period corresponds with a time of severe isolation due to COVID-19 pandemic. We have a critical program to assist those in those unprecedented times. The Office for Aging has received a grant from the New York State Office of Mental Health for the past 4 years now. We're into our 5th year. It's a demonstration grant. And we offer the Senior Health and Resource Partnership Program, also known as the SHARP Project. And that serves people aged 55 years and older that have suffered with addiction, depression, and other mental health issues. It provides care management, linkages to aging and mental health services, and substance use counseling. During the height of the pandemic, I don't want to say we were proud to say, but we were very happy to say that our project here in Onondaga County had the most admissions to help people in need than any of the other programs throughout New York State. So we're very proud of that we were still able to help those who were isolated, alone, and suffering. At the last quarter of 2019, I have one more thing to say about that. Our November survey had 111 local providers as well to give us some input. Their answers showed that the Office for Aging is a critical referral source for them. 82% of responding service providers said they contacted the Office for Aging for information and assistance on our programs and services. 82% of our providers contacted the Office for Aging for information and assistance on our programs and services. So we're very, very proud of that. And at the last quarter of 2019, the Office for Aging proudly received an $80,000 age-friendly planning grant from the New York State Office for Aging. We and the Onondaga County Health Department serve as lead conveners of critical stakeholders from government and community organizations. The goal of this project is to address issues, problems, and opportunities at the local level that will promote policies and programs that replicate and align with Health Across All Policies, Age-Friendly New York State Initiative. The grant will fund the newly formed Livable Communities Alliance of Onondaga County, which will address and incorporate smart growth principles, as well as the 8 domains of age-friendly livable communities as outlined by AARP, and building upon the existing economic and environmental infrastructure we have, as well as a social programming that's already in place. New York State is very proud to be the first state in our country to achieve an age-friendly designation. The Livable Community Alliance of Onondaga County will solidly support that designation by promoting health and social equity to all residents and ensure systems align to make age-friendly Onondaga County a great place to be young and grow old. The height of the alliance, or the alliance, which opened at the height of the COVID-19 pandemic, and it has been very successful so far. It is facilitated by Focus Greater Syracuse, and I would like to say right now that many department participants from all of county government are also joining us on this initiative. So we're very, very proud of that and very grateful. So that's all that I have to say, and I'm going to turn that back to Commissioner Alford.
Okay, just very quickly to end, it's certainly been a challenging year, but we're optimistic about the future. We've gone from helping seniors, assisting them and giving them information about not only the New York State hotline for the COVID vaccine, as well as helping them sign up for the on list. Occasionally, when they haven't had an email, we've also actually helped to email on their behalf. Joanne and I are certainly very proud of our staff members, and many of them have worked in being very flexible this year to assist in various ways. Many have worked remotely for the past year, and most of them are now back as of the 15th of this year. And we continue to offer the same level of service that our department is known for. And thank you again for allowing us to share with you today. And we'll answer any questions you may have.
Thank you so much. I think I can speak for the committee that we're so proud of the work you guys do, and it's tireless. I mean, you're looking at all the initiatives and the stuff that you continue to roll out in support of our seniors during a pandemic. It's just noble and awesome work. I have one random question. The SHARP program, it's necessary, and I'm encouraged to see how many people actually participate. Did you service through that? Do you know? I was just curious. Like a roundabout number, maybe.
Joanne, what she's asking about the SHARP program and the number served with the SHARP program?
Thank you. The SHARP project?
Yes.
Okay. How do people participate in that?
It doesn't have to be random. I just have no clue if it's 20 or 2,000. So, you know.
Thank you. Thank you for asking about that. We did a lot of advertising and a lot of outreach when the program first started in 2017. But what's happened is that it's really word of mouth and it's self-referral. So we had targeted groups when I wrote the grant, and it turned out that when we were outreaching to those groups, word of mouth started, and particularly with seniors, and definitely during the pandemic. We partner with Liberty Resources and Helio Health. Those are our two mental health providers. So, and they also make referrals to us.
Okay. Does anybody else have anything they want to ask?
I'm not on committee, but may I ask a quick question?
Sure.
Thank you. This is Legislator Kuhn. I was just curious if I get perhaps the SHARP program is the mental health and addiction services. Is it? I didn't know what that meant.
Yes.
The grant that was for mental health and addiction. That's what that is. So
Yes.
is it mostly a referral service, or is there direct provision of services?
We have subcontract with our provider for mental health is Liberty Resources, and the subcontractor for the substance use services is Helio. And so we work with both of those organizations. We have contract staff that actually go out into the home. Sometimes we've had to assist with seniors that aren't able to leave the home. It may be a laptop actually in the home to provide services in a model that way, to provide services for seniors who are unwilling or unable for whatever reason to leave their home. But yes, we work with both of those organizations so people can actually get direct services.
Wonderful. So you're funding, this grant is funding those positions at Helio and at Liberty for the seniors.
It funds for the telehealth services with those providers, as well as 2 contract staff that we have that work in our office as well.
Oh, you do have in your office. That's what I was wondering.
Yes.
Thank you very much.
Great. So can I ask one random, is it possible to share the slide deck with the committee or the legislature? Can you, Pat, I don't know if it's.
Yes, we'll be giving that information to the office, so it can be included also as part of your minutes.
Phenomenal. Thank you so much. Anybody have anything else?
I'd like to say something, please.
Oh, go ahead, Legislator Kinney.
Thank you.
Yeah.
For those of you who don't know, I became the power of attorney for an 85-year-old lady who's deaf. And I want to thank Joanne for all her help. I'm still having lots of problems, but it's not Joanne's fault. It's my fault mostly, I think. But Joanne's been wonderful, and I want to recognize her publicly for that. I do want to say, though, that I don't know how people do this, that don't have the wherewithal to reach out to somebody. People that are elderly and stuck in these situations, I'm really shocked that here it's 2021 and we still have a system like we have. I just can't believe, and I'm not blaming anyone, by the way, I'm just pointing out from my experience that how hard this is to help someone that is obviously in need of help. I mean, she comes, very little money, and she was born deaf. But I wish there was some way to have a better system. But I do want to thank Joanne publicly, like I said, for all her help. So thank you for letting me say that.
Thank you very much. I also want to answer Legislator Abbott-Keenan and how many people that we serve in the SHARP project. I have a little difficult time hearing. You probably have got noticed that by now. So thank you. We currently have 228 admissions. And it well exceeded what I had anticipated back in 2017. So thank you for asking that. And thank you, Legislator Kenny. And also I want to thank you for your support on our Aging Services Advisory Board. Also, Legislator Bush is on. I can't see his face, but I know he is on. And thank you for your past support as well on the Aging Services Advisory Board. We certainly cherish and appreciate it.
Thanks, Joanne. Thanks, Commissioner Alford.
Julie, can I say something?
Sure. Peter Irvin.
Thank you. I have always been supportive of Commissioner Alford and Joanne. They've done a fabulous job with anything I've ever asked of them. And I'm just wondering, throughout this pandemic, with so many people being isolated, have cases risen with elder abuse or with that sort of situation? And how are you staffed properly to handle the spike that has resulted from that?
As far as the numbers of persons that are receiving services through our elder abuse program, we certainly have seen those numbers continue. It's just really a trend that we're seeing as we're seeing the aging of persons in our community. Those numbers continue to go up. We have certainly seen an increase in the number of persons that are needing a guardianship. And those are persons who are really in a situation where they don't have, they are unable and they are unable, they don't have any other support to be able to take care of themselves. So we actually have guardianship for several people. The challenge is, being able to balance the cases we have with those that may require more intensive support with the guardianship program. So we always are looking for ways to maximize the staffing and the resources that we do have, as well as how we go about working with the families that we do have. One of the advantages with us being connected with the Office for Aging and Long-Term Care is that not all, but certainly a large percentage of them are persons that are elderly. And so many times they may need the supports that we have. So we have a seamless way of doing transitions or referrals for meals. It may be a neighborhood advisor who periodically goes out, in addition to what a neighborhood advisor or someone who works in our adult protective services area may do. So we really try to combine and utilize services from all of those areas to make sure it's as seamless as possible.
Well, certainly, if there's anything we can do to help you, please let us know that, because we don't want anyone in our community that's elderly suffering because we have not given you the proper resources.
Thank you.
Thank you very much.
Julie?
Is that Peggy?
No, it's Deb.
Oh, hi, Deb. Legislator Cody.
Thank you. Thank you so much, Lisa and Joanne, and I see Ellen there too. You guys have always been such a great resource for help. And anytime I've reached out to you to help some of our seniors, it's just always been a great experience. So I'm just wondering, like on some of the Zoom offerings to the seniors, how many of them are able, was there any kind of like training or to help them be able to navigate the Zoom world through all of this?
I will start off at least with the caregivers. the caregivers, that's been a really a very good option for many of them, because one of the things we found is sometimes caregivers are so busy, they weren't even able to come to some of the in-person activities that we had. So it actually has opened it up to maybe people who weren't able to attend or participate in the past. They could stay there. They could stay there at home, watch it from their phone or whatever other device. So at least with caregivers, I do know it has been helpful to have that, particularly for caregivers. Joanne can sort of speak to the other areas in which it's being used with the other chronic disease self-management, some of the other classes.
Thank you. Thank you. We have had a lot of participation. Again, as I mentioned earlier, as Lisa just said, with our caregiver services, we're looking at people that are caring for older adults and have a lot of access to this type of platform. For our other programs, our senior centers, those who are operational, are assisting people with Zoom. We also have our neighbor advisor programs who are doing the same thing. A lot of our seniors now that are reaching out to the Office for Aging are people that are in the youngest seniors, 60 to 75 years of age, who also have access to Zoom. So we are, we're looking at that platform. We know it's not the end all and be all of how we can reach and help people, but it certainly is inching up there in terms of how we can get the word out and how we can get them the assistance that they need.
Yeah, obviously it's a great option for them if they're able to navigate technology and they have a, computer or an iPad or anything. I just thank you for everything that you did through the pandemic. I mean, it was a huge undertaking, to deliver meals to these folks and deliver groceries and paper products. And I just, everybody really rallied to that. I was privileged to be able to, to see that firsthand and interact with some of the folks. And it was just, being able to see them and talk to them through that, it was just such a lifeline to them, and they were so appreciative. And we just appreciate you and everything that you and all the folks over there have been doing through this. So thank you.
Thank you
very much. I remember those times when all of those things were being distributed, and our nutrition unit was right smack in the middle of it. And they did a wonderful job. But the thing is that we still have some of those supplies available. So now we're looking at giving them to our adult protective workers. So where people who still do not have access to that or can't go out and need those in an emergency situation, it's 4 o'clock on a Friday, we're able to access some of those supplies as well. So it continues.
Great.
It continues.
Thanks.
And I wanted to say, I didn't know Linda, Legislative Irwin, was on the call, and she was part of our Aging Services Advisory Board too for a very long time. So I want to also thank her for her support over this. Thank you.
Great. Thank you guys very much. Okay, we are going to move on. And we appreciate you sending that slide deck so we can absorb all the stats. So it's awesome. Thank you. Okay, so
Julie?
Yes.
Can I ask one question I forgot?
Sure, Bill.
Thank you. That study you did on depression and things, what age group were you talking about? 60 and over, 65 to 85?
It was 60 and over.
Okay. Well, see, I find I get depressed on the first Tuesday of every month. I don't know why that is, but I just thought I'd throw that up.
Stop it.
Okay, thank you.
Gotta laugh in life, folks.
Yes, you do. Thank you very much, you guys. Have a great week. Okay, so we're going to move along to our phenomenal Health Commissioner, Dr. Indu Gupta, who has been tirelessly working at our latest drive-through vaccination clinic. So Dr. Gupta, thanks for joining us. You want to tell us how those are going?
Yes, thank you. Thank you, Chairwoman Julie Abbott-Keenan, and to all the honorable legislators. And I'm privileged to have that, especially listening to Commissioner Alford's and Deputy Commissioner Joanne Spododecker's presentation. There's a lot of work being done by many other departments, and they have been a very great partner with us in working through, and that involves so many other departments. So I just want to give you, yes, so today is our second day of the drive-through clinic, which is working very good. We have 1,400 people signed up today. Yesterday, we
Wow.
vaccinated 900 and, what was that, almost 1,000 people actually got vaccinated. People are coming. I was there this morning. I'll go a little bit later in the afternoon. I was there all day. It is very smooth operation, knock wood. I'm just going to make sure that things are doing okay. People are coming, and from Sheriff's Department helped in the traffic to many other departments, including our many other temporary workers who have been hired to do a lot of work, along with the nursing staff, pharmacists, and doctor volunteers. Emergency management, it has been phenomenal work, and parks, and I mean, you name it, every department is probably there. It's such a great teamwork. So if the weather allows later in the future, we would do that again, because we can actually, the funny part was that last appointment was at 4:20 yesterday, and 4:30 there was no cars there. I mean, the cars at the entrance so sheriff didn't have to stop anybody. That was great. And it worked very well. So we look forward for better weather and hopefully more. And at the same time, I think today we have another pop-up clinic at Atonement Lutheran Church. So that will start at 1 o'clock. And as you know, many of the other pop-up clinics which we have done, I think this will be our 11th, as far as I remember. There are some small, some bigger ones. And at this point, I think they are serving quite a bit of purpose to re-energize people. When I go and visit I go to attend every one of them. The people who are getting vaccination, they're so excited that they are literally telling me, several of them I have spoken to, that we're going to go and sign up few people. So a few of them I showed a little trick in the iPhone, how to download your, the registration form that you can put it in yours. So they say, oh, that's a good one. So that gives a good conversation at the same time. It just gives something to them. They don't have to Google every single thing. I said, go do this, and then teach 5 other people that. So registration becomes very easy for them. Because as you know, in the beginning, we were doing a lot of special populations and all. Now, because the appointments were flying off the shelf within 8 minutes, 5 minutes, right? And then a few times county website crashed. So now that is not happening. And now people are more comfortable. There are more variety of places they can